based on our results, we proposed going in and working with the providers to target that interview. That is a second opportunity to identify whether or not anything is going on with that service member. If they're having physical health or mental health issues that they didn't previously report on a questionnaire. Maybe they misunderstood something. Maybe at the time they were just trying to get it done. Who knows? So this is a face-to-face relationship that can be built. And what we determined together with an expert panel from the military and talking to a lot of military healthcare providers, we decided to focus on the interview and the communication patterns and the relationship building.
The soldier doesn't necessarily want to divulge these kinds of symptoms. The soldier wants to make sure that he or she is ready for their next duty assignment. Certainly, as Susan and others had found out in previous work, that certainly there's and we know in mental health there's a stigma associated with with having certain symptoms that might be related to mental health issues. And so probably most unlike patients, soldiers may not actually want to disclose these things. And so even more importantly, that we had to try to find ways to help providers to have soldiers open up.
And I think it might help to understand the context of the PDHRA. So at a typical military installation, they have what's called, for the Army, they call it soldier readiness processing, or they have a soldier readiness center. And as part of the deployment cycle, commanders basically have to make sure that the soldiers under their command are deployable. Being deployable, part of that means the medical checkoff. So these SRPs are large, gymnasium-sized, typically, places where a soldier is moving through. They're getting all the medical checks, immunizations, eye check, dental, et cetera, et cetera, et cetera. This is just one piece of that. So we need to make sure that the viewer understands this is not a typical medical encounter where you're going to your doctor, something's on your mind and you want to talk about it. This is a part of a much larger process. So there's already that piece to it where I think as part of this kind of a big process, it could just be something to be checked off from both the soldier and on the medical side. If that soldier has something that's going on, they'll tell us. And so what we do is we go in there and we know, number one, these are healthcare providers that we're working with. They are professionals. There is much that they do that we can come in as the outside experts to help them beef it up because it works. We chose communication, we chose the relationship building to focus on because the research shows that, and we've all had that experience of, if you go in to see a healthcare provider and you feel like they know you, they care about you, you're more likely to disclose what we call psychosocial issues that have to do with relationships or how you're doing emotionally. And second, we know that those patients are more likely to comply with treatment.
Right.
You know, one of the examples that you give is, you know, you go in to see the doctor, I'm not sure he really gave me this prescription, and you don't go fill it. That's the example of what we're trying to address.
I think another thing, Susan, that we try to do with these providers is to make sure that that they appreciated that they have a great deal of expertise that they should be using to try to guide the soldier along to try to make a good decision about a referral. And so one thing that we would try to avoid, the provider saying something like, well, do you want a referral for that? As opposed to the provider saying, now, in my experience, the kind of symptoms that you may be having may really be related to things that are going on that might need more evaluation. And so based on my experience and all the soldiers I've seen, it might be a good idea that you really see someone else that could help you to assess this. And so that's very different. It's a very different use of their expertise as opposed to being taking a totally autonomous view and really saying to the soldier, well, do you think you need help for that? So we really emphasize to the providers that you are experts, and make sure that you are using the clinical evidence to try to influence the soldier's desire to accept more assessment.